There for Care is brought to you by CareScout with the goal of sharing real-life conversations about aging care. Views expressed on this program are the speaker's own. We do not provide medical, legal, tax, financial, or other professional advice. Always talk to your own professional advisors for advice tailored to your needs.
When I was first practicing medicine, dementia was thought as inevitable, unstoppable. We never thought about using the word prevention and dementia in the same sentence. But the science has changed dramatically.
Can we really start to think about dementia as preventable?
Yes, we can. And it's amazing. And I'm really excited about it. Depression is a known risk factor for dementia, especially when it's prolonged or recurrent. The Commission has noted that up to 45% of dementia risk can be prevented with these 14 modifiable risk factors. Whether you're caring for a parent or thinking about your own future, these risk factors, I think, give us a place to start.
Hello and welcome to There for Care by CareScout, a podcast all about aging care, whether you're navigating it for yourself or your loved ones. I'm Jeremy Sawvel, and today I'm joined by Dr. Aaron Rosenberg, Chief Medical Officer at Genworth and a certified board internist with over 20 years of experience in healthcare leadership. During the podcast today, Dr. Rosenberg and I are going to talk through the 14 modifiable risk factors for dementia and the steps that can be taken to help prevent the disease in the future. Dr. Rosenberg, thank you for being here.
No, I'm happy to be here. Thank you very much, Jeremy.
Yeah.
So what's interesting is when I was first practicing medicine, dementia was thought as inevitable, unstoppable. We never thought about using the word prevention and dementia in the same sentence. But the science has changed dramatically. And now we're really in a position to create a population health-based approach to dementia. And I'm really happy to be here.
Yeah, well, and I'm really excited to dig into this. And some of our conversations, my 15 years in the long-term care space, dementia has always been something that I've heard talked about as we don't really have a whole lot of control over it. It may happen, so let's prepare for just in case, hope that it doesn't happen. And, you don't really have the seat in the driver's seat to dictate whether that happens or not. So from everything we've talked about, can we really start to think about dementia as preventable?
Yes, we can. And it's amazing. And I'm really excited about it. So this is based on the work of the Lancet Commission on Dementia Prevention, Intervention, and Health. And it was published last year. For those that don't know, the Lancet is a world-renowned leader in research and medical literature. They've been in existence since 1823. So they've been publishing for over 2 centuries on groundbreaking medical literature. This commission was formed with expertise from psychiatry, from public health, from neurology, and they looked at literature on the subject of dementia for the past 10 years and came out with these recommendations and these risk factors.
So for those listening, healthy skeptics, right, which is a good thing. We want to be able to make sure that information has been vetted, that it's quality, where it's being reported is valid. So to kind of recap what you said, this is a very valid report and the information has been vetted and it's quality, right? Like this is real.
Now, I think during this discussion, it goes without saying that we're not practicing medicine. We're not recommending anything in particular to anyone. We're simply reporting the information that has been gathered by this commission.
Okay, great. Well, let's dive in because again, I think this is such an important topic and it can really start to, in my opinion, change the way that we think about how we plan for care in the future and knowing that there are things that we can do to potentially dictate our future a little bit.
Right.
So 14 modifiable risks, as we talked about. And from reading the report and talking with you, you have early stage, you have mid stage, and you have later in life. Can you start digging into the 14 and start with early stage and midlife?
Sure. So the Commission has noted that up to 45% of dementia risk can be prevented with these 14 modifiable risk factors. Each of these risk factors has an impact percentage associated with it. And they start, like you said, in early life. And the first one is early life education. Now, we can't go back and change the things that we've learned, but I think what it does do is it emphasizes the importance of lifelong learning to build up a cognitive reserve. So it's sort of a memory bank that enables us to compensate if there are any brain changes that occur. So the importance of lifelong learning comes from this particular risk factor, and it is an impact of 6% of the 45%.
Okay, great. So that's early. And then when we get into
midlife starts with one of the most modifiable risk factors, in my opinion. And it also has the highest impact. It shares that with another one that we'll get to, but it's hearing loss. So hearing loss contributes to social isolation. It mitigates the sensory input that you get in life, and it is so easy to potentially correct. So there are many different things that we can do to mitigate this risk factor. There are app-based hearing applications. There's one that's available at the Google Play Store and Apple, and it's from the World Health Organization. It's called Hear Who. There are app-based products. One is the AirPods from Apple, but there are certain things that we can do to mitigate this risk, and that is get your hearing checked, starting at midlife. And if you have someone that you're caring for, you can speak to their provider about when their last hearing exam was and emphasize the importance of that. I think what we're saying is if you treat hearing loss, you're actually protecting your brain. And it's been shown in this study, in this commission's report, that the use of hearing aids can actually prevent cognitive impairment. And as we move to the next risk factor, it's also as impactful, 7%, same as hearing loss. And this is high LDL cholesterol. So this is the bad cholesterol. This is the one that causes vascular damage. It's been linked to Alzheimer's pathology. And this is another very easy risk factor to mitigate. Know your numbers. Starting at age 40, you should know your cholesterol numbers. And everyone should focus on getting their LDL cholesterol less than 100, and sometimes less if you have other cardiovascular risk factors. That can be done with dietary changes. That can be done with statin medications, physical fitness. There are many different things, but I think it emphasizes the need to know your cholesterol profile starting at midlife. After the LDL cholesterol risk factor, then we go into depression. So depression has an impact weight of 3%, and depression is a known risk factor for dementia, especially when it's prolonged or recurrent. So things that we can do immediately are recognize the symptoms of depression. So things like fatigue, poor concentration, persistent sadness, a lack of appreciation for things that previously were fun for people to do. And talk to your healthcare provider if those symptoms are present. There are effective treatments, there are medications, there's therapies. Combination of both is often a good solution. And emphasize things like social connection, physical activity, meaningful routines can often make an important difference as well.
So we have early life where we have education and learning, right? And as you said, you can't really reverse time on that, but they're just maybe reading more, doing a little more research on things, continuing your learning, right? So that's something that we have a little control over. Hearing loss, that's something, as you mentioned, we can identify that. There are apps, there are other technologies that we can utilize to our advantage there. The LDL and cholesterol, getting those checkups and understanding what your levels are and how you can adjust that for the better. And then depression, which is one that, thankfully is talked about more and more now, I would say, than in the past. There are things you can do to help better the way you feel, help improve that. So, we're 4 in of the 14. And if I'm hearing the percentages and I'm adding those up, that's 25% of the 45%. So that's a big chunk right there, right?
It's huge.
And again, they're things that I don't want to say they're easy because nothing is easy, but they're there are steps that can be taken. Is that
Right.
fair?
Oh, yes, we're in control. And these are some things that are really high value to preventing or forestalling cognitive decline. Now, there are some risk factors that may not be as impactful or meaningful. The next one I think we'll touch on, it's traumatic brain injury. Now, much of this comes from contact sports when you were young or various other traumas. But I think what it tells me is that there's an importance to making sure that you're focused in your later years on fall prevention, mitigating the risks from any concussive trauma to the head. So there are things that we can do to make our living spaces safer. And that involves making sure they're well lit. You're removing tripping hazards. You've installed things like grab bars. All those, I think, become very relevant for this particular risk, which has an impact value of 3%. And also, I think, making sure that your vision and hearing are checked as well, because when you have less stimuli to the brain, I think it puts you at greater risk for fall. The next risk factor is hypertension, and that has an overall impact of 2%. Now, treating hypertension to the American College of Cardiology and American Heart Association guideline of less than 130/80 has been the standard now for years, almost 10 years. And I think it's important to know your numbers here, because controlling your blood pressure, as well as focusing on things like hypertension risk and diabetes, can not only impact your cardiovascular health, but also improve your brain health as well. I mentioned diabetes, and that happens to be the next risk factor. It has an impact level of 2%. And diabetes is defined by a fasting blood sugar of 126 or higher. And it's linked to vascular damage and also the acceleration of Alzheimer's pathology through metabolic and inflammatory pathways. So keeping your glucose levels well controlled can protect your brain. And that's the importance of this risk factor. As we proceed, the next risk factor is smoking. Now, smoking has a 2% impact. And I think if you're smoking in this day and age with everything we know about tobacco use, it's probably safe to say that brain health isn't your first priority. But the good news is quitting at any age can create benefit for your health. And there are many different treatment strategies. There's nicotine patches, gums, there's therapy, there's quit lines, and usually a combination of those approaches is going to work best. But I think the bottom line is we should quit if there's any tobacco use, and there's a growing body of evidence on the non-combustible tobacco inhalation as well. So things like vaping or cannabis use, they may come with their own neurologic impacts. So I think it's safe to say that if you have someone that you're caring for, or if you're thinking about quitting, do it now. The next risk factor is physical inactivity, and it's 2%. And for me, movement is life, and I think that's the way we need to think about this. You don't have to run marathons to become physically fit. You know, a brisk walk on most days, and maybe you can do some strength or resistance training 2 days per week, and add some activity to your day. If you're on the phone, do some pacing, stretch if you're watching TV or something of that nature, because I think that physical inactivity is something that is easily addressed in ways that don't require gold medal Olympic winners.
Yeah, you don't have to go above and beyond necessarily to make this count. I feel like you hear a lot about sitting and some of the damage that can do to us. And I sit in front of a computer a lot when I'm not out, running around, and just getting up and going for a walk, stretching a little bit, just having some of that activity. So I'm hearing from you that has a big positive outcome.
Absolutely. Absolutely. And I think it's related to our next risk factor, which is obesity. And that has an impact of 1%. Now, the Lancet Commission defined obesity as a BMI of 30 or greater. And if you have any questions, you can talk to your provider about BMI, body composition, waist circumference. But obesity contributes to insulin resistance. It contributes to inflammation, and that is probably the nexus for its impact on cognitive health. So aim for a BMI under 30, incorporate the physical activity that we just talked about in your life, and choose your diet well, reduce saturated fats, increase lean proteins. And if you're still having difficulty, there's always the opportunity to speak to a registered dietitian or your provider about other things that you can do. So the next risk factor is excessive alcohol use, and that has an impact of 1%. So heavy drinking affects brain structure. It also impairs memory, and it speeds cognitive decline. In fact, the World Health Organization has said that there is really no safe level of consumption for alcohol. But to stay off of this particular list, you want to limit your drinks to 1 per day for women and up to 2 per day for men. Take alcohol-free days each week. I think that's important. And really, if you're already at risk, or if you're caring for someone that is, less alcohol is best. As we've gone through these risk factors, we've gone through midlife, and now we're to late life. And the late life risk starts with one that is incredibly actionable, and that is social isolation. It has an impact of 5%. And staying socially connected protects your brain. And I think what I want to emphasize here is loneliness is not just a feeling, it's a health risk. And there's things that we can do to address it. The Lancet Commission felt that this is a potent yet modifiable risk factor for dementia. And there are many things that I think we can do that may not be intuitive. The power of technology, using video connection to mitigate loneliness, I think is important. Scheduling interactions with your family and friends and community members, virtually or in person. There's things that we can do with community groups and church groups and volunteer organizations, and even people that can come and check on you, and you can develop that sort of that social connection. So I think it is important. The next risk is untreated vision loss, and I think this is equally actionable. Vision connects us to the world, and keeping it sharp helps keep our mind sharp. So correcting vision problems is a simple, high-value thing that we can do. It should start at 65. You should get your vision checked every year or sooner if you have symptoms or if you have chronic medical conditions. And of course, there are other things that are actionable with your vision. If you have cataracts or glaucoma, make sure that those are well cared for. But this is something simple that we can do to maintain that stimuli to our brain, which I think is probably the mechanism of action for this risk factor. We're at our last risk factor. And this is one that I'll mention, and I'm not sure how actionable it is, but it's important to be aware. And it's air pollution, and it has an impact factor of 3%. And it's the final of the 14 risk factors. And I think while it's harder to control that individually, it's something to be aware of for our environmental exposure, for cleaner living spaces, and planning on where you're going to live. But I think as we've gone through all 14 of these risk factors, it's not about perfection. It's about progress. It's about sort of focusing in on these high value, high actionable items to mitigate your risk of dementia. And the most impactful we've gone through, hearing loss, high LDL, social isolation, untreated depression. These are things that have very actionable solutions to mitigate your risk for dementia. So, whether you're caring for a parent or thinking about your own future, these risk factors, I think, give us a place to start, and they're easy to address.
Yeah, that's what I love. And thank you for going through all 14 of those. I felt like it was important to hit all those. And I'm thinking through, regardless of what stage you're at, right? Whether you're early life, midlife, late life, there are, whether like air pollution, like you said, maybe that's something you can't control necessarily, but you can be aware of, and you can be cognizant of, what is that air pollution and how is it impacting me? Every single one of these, I'm taking a bearing on myself. I'm thinking about my mother who is in, a later life. And there are things that I can be aware of and at least track, or I can be aware of the specific numbers behind it, or I can be aware of the environment that I'm in, and knowing that, again, these are all impacting. You and I talked about not just longevity. A lot of us, we want to live long lives. We want to live long, healthy lives. And part of that is having a healthier, stronger brain as we age. And so, going back to the beginning of this podcast, to say that these are things that we could be potentially made aware of and take action on. We are preventing certain mental diseases, and we're also allowing our lives to be more fulfilling. And that changes a lot of the conversations that we've had about, how do we ensure that we have that long-lasting, fulfilling life?
I think it's a great point, and it's an insightful one, because what we want ultimately is we want our health span to be a greater percentage of our lifespan. And these risk factors will not only increase your lifespan, but will also make your health span a greater percentage of that. So your period of time where you may need care shrinks. And if we can forestall or prevent cognitive decline with some quick and simple, easier things to do, I think that is empowering for people. And it's not like when I first started practicing, not to date myself, but like I said, we always thought of dementia as inevitable, unpreventable, and we would diagnose it, but we couldn't prevent it. And now we're realizing that we have 45% of dementia cases that can be actionable.
Yes.
So I think it's really important information.
Yeah, it's powerful. It's powerful. Well, so, and I have to ask, and I'm sure individuals listening are thinking about this too. So we went through our list of 14, right? And a lot of those are very high percentage, very important as you went through. What about, I feel like anything revolving around health, you hear about sleep, you hear about stress, you hear about nutrition. And I think there are some obvious impacts to like LDLs and some of the things we're talking about, but how important is sleep, stress, nutrition to your brain health?
They matter, and they matter a lot. And I think what we've reported here is the commission's findings, but keep in mind, they've looked at population-based research for these things. And some of that research doesn't exist for the factors that you brought up. So when we think of sleep, for example, poor sleep and disorders like sleep apnea are, I think, clear risk factors for cognitive health. And we want to prioritize at least 7 to 8 hours a night of sleep. If you snore at night or you feel unrested during the day, these are opportunities to speak with your provider about those types of things that may have an effective treatment and ultimately go on to provide additional protection. So we're not saying that those are unimportant, or we're not even saying that they aren't risk factors. It's just the evidence right now on a population level hasn't gotten to the point where they are formally included in the Lancet findings. And the same holds true for stress. I think stress drives chronic inflammation, and chronic inflammation is the nexus for some of these adverse brain changes. So caregivers, especially, they need support, and we need to make space for breaks for them and create routines and make sure that everyone's emotional health is also a priority, because I think that's also going to be impactful for mitigating cognitive decline. And the last thing you mentioned, I think diet goes without saying, and it's so interrelated with many of the other risk factors that we spoke about. Like you said, LDL, like making sure your glucose is controlled, and high blood pressure is treated to the goal. Many elements of your diet can contribute to those very known risk factors. So I think it is related. We've seen things like the Mediterranean diet and the pattern of impact that it may have on preventing cognitive decline. And I think that's probably a real risk factor that can be mitigated as well. So even small changes in your diet, increasing vegetables, decreasing saturated fats, increasing lean proteins, all this can have a very beneficial effect on your overall health.
That's great. That's great. This has all been really great information. I can't thank you enough for being here. And, when I think about that narrative again of kind of putting ourselves in the driver's seat and being able to control and dictate more of what the future will look like. And as you were talking about, have more of that higher percentage of that quality life. These are all steps that we can take. So really appreciate it. Dr. Rosenberg, at the end here, as we wrap up, if you have any final comments or maybe a call to action, if you will, for anyone that's listening, what might you say to everyone listening today?
Well, we have more control than we think, and we certainly have more control than we ever thought we could. Back when I was first practicing, like I said, it was all thought to be inevitable. Dementia is not inevitable. We have specific risk factors that we can mitigate to ensure our continued brain health throughout our life. So this is a population health opportunity. It's a call to action. It is empowering. And I want this information to resonate because there are things that we can do right now to preserve our cognitive health.
That's perfect. Perfect. Thank you. I hope everyone listening took a lot out of this today. And remember to like and subscribe. Thank you for listening. This is There for Care, and we'll see you soon.